Hey everyone. Good evening. Good evening. Um, so, Welcome to tonight's live with your career coach Rod, helping people get into digital health, but really just clinical people, right? So, drop me a heart if you're a doctor or a nurse or someone in allied health, so I can tell who's listening out there. And remember, I'm Rod Gamble, digital health career coach. I'm a nurse, I'm a computer scientist, project program manager, lived and worked all over the world. You can tell that I'm not from England, but I definitely live in northern England these days. I've driven system-wide changes across hospitals, healthcare systems, and sometimes even small countries. I really enjoy the work. I find a lot of meaning in it. Quick question for everyone: when was the last time you finished a shift and felt like you truly changed something? Not just for like one patient, but like at a bigger level. Let me know. Because this didn't happen to me while I was on the floor, while I was at the bedside. Today, we're going to be talking about, we're going to be going a little deeper on meaningful work and what it actually means in 2026 and why so many clinical people have lost it. And more importantly, how to get it back by working at a different scale. Got about 15 minutes of chat tonight, and I'll be reading comments throughout and then again afterwards. I remember being at the bedside. I remember working my tail off, and I remember leaving, going home, and thinking, I'm a cog. I clock in, I clock out, I do what the system tells me to do, and nobody would even notice if I disappeared tomorrow. They'd just call in another person to cover me, right? I don't know, like it didn't really matter. That's what it really felt like. And that's not why any of us really got into healthcare. The the moment hit me because when I was doing shift work nights and weekends and holidays and all the rest of it, and I'm missing things. I'm missing time with the family. I'm missing dinners. I'm missing ordinary moments that turn out to be the ones that matter. And I'm still wondering whether the sacrifice was worth it at the time, and whether the work itself um, could ever be meaningful again. That was, sort of where I was. Um, and then I went and I decided I was going to do this digital health stuff. And I went and I talked to my boss, and I told my boss, I said, "Look, I'm done with this. I'm leaving. I'm headed out." And she didn't push back. She wanted to go. How did you do that? Where are you going? How does that work? How can I do it too? Um, for me, that was a surprise because I was like, this is my big boss. This is the person who like lives here. They're part of the furniture. No, no, no. They wanted out too, and they were farther up that ladder than I probably ever would be. Right. That confirmed it for me that the system wasn't keeping the best people, and the people who left weren't abandoning healthcare. They were finding ways to serve it on a different scale. So if you've ever felt like, an overqualified waiter on the job, skilled, experienced, licensed, but somehow still invisible and inside of the machine, well, that's what this session is all about. That feeling isn't a career problem, it's a signal. So, um, so here it is, the conventional belief that we clinical people believe that meaningful work means being at the bedside, one patient at a time, and that's where the impact is. And then my belief, and it's a beautiful instinct here, is that is just a cage, because digital health is where you touch not just one patient but 10,000. You can make such a huge difference in so many different lives, right? So, what if the most meaningful thing you could do for your patients is to never again see one directly? Hmm. Clinical transformation consultants, informatics leads, AI implementation specialists, they're all improving outcomes for entire populations of patients. The doctor who helps design a sepsis prediction tool isn't in the room when it saves a life, but the life is still saved. Um, right now, the NHS says that it needs nearly 12,000 more clinical informatics professionals by 2030. That's not that far away. 12,000. And who are they looking for? It's not coders, because you can get AI to do that for you now. They want people who understand what happens when a protocol fails at 3 in the morning. They want clinical people. They want you. BCG just put out research this year saying that 2026 is the year AI becomes embedded into the everyday fabric of healthcare. Not pilots, not experiments, the real thing. And here's the parallel I keep in mind, and I keep making this point. This is like the EHR moment all those years ago, but all over again. Remember when electronic health records had landed and nobody really knew how to use them and nobody trusted them and blah, blah, blah? Well, the clinicians who stepped in then, they became the informatics leads. They became the implementation specialists. They became the go-to people. And we made a lot of money doing that. That window is opening again now for AI. But it won't stay open forever. We're inside a 3-year window right now, I think, 2027 to 2029, right? Just coming up here, where the demand for clinical people in lead roles for AI will peak before the market floods with non-clinical technical people who have learned the language. The clinicians who move now will set the benchmarks. They'll set the salary benchmarks. They'll be the ones making the most money. They'll be the ones who are actually setting the pace for the rest of us. And anyone who waits will be the ones competing on price for that same work. You can work for a little bit less, right? Meaningful work in 2026 isn't about choosing between patience and purpose. It's about choosing a bigger stage. So right now, let's talk about some of the roles that you can get, because these are real. These are, in the market right now. This is how the world is actually working. Patient outcomes at scale and serious compensation. First role to mention, healthcare innovation lead and clinical transformation consultant. These roles exist in the NHS, HSE, U.S. health systems, and global consulting firms. You're advising on how to implement AI, telehealth, or digital tools, and your clinical background is what makes you trusted in the room. Starting salary, $70,000 and $90,000 per day, or $70,000 to $90,000 per year in the UK, $120,000 to $150,000 in the US. Freelance rates pushing between 600 and 900 pounds a day. Sorry, got my days and years mixed up there for a second. And I was called today for one of these. A gentleman here in the UK has clinical people who are set up to do this work, and was trying to connect the dots. And I had to tell him that I'm a little busy in my personal life and that I will not be joining in those reindeer games. Not right at the moment. I'm going to train people like you to actually go do that. Here's another role, clinical informatics specialist. This is a person who's a bridge between clinicians and IT. This is pretty close to the kind of work that I did. You understand the workflow, you understand what breaks, and you understand why the tech people need to serve the human people, the clinical people. The NHS Fellowship in Clinical AI right now is actively recruiting clinicians for exactly this pathway. A 12-month program, 2 days a week. That's a funded route in. Anybody can do that in the UK right now. Here's another role, digital health advisor, policy consultant. This is legacy building work, because you're going to be shaping MHRA guidance. For my folks in the US, that's pretty much the same as the FDA. You're going to be setting the NHS's digitization process. And in the US, you're going to be working with the CMS mandates for how this actually has to be implemented. If you want to drive system change, not just in one trust or one hospital, but across a country's whole healthcare landscape, this is the end game. I was in Pakistan working for Aga Khan University, and I had the chance to help them leapfrog 20 years of problems with the right digital strategy. This is that sort of scale, these kinds of roles. And let's be clear here, I'm never pushing any particular vendor or particular platform. I don't really care. The skill is you. That's what really matters. The clinical lens that you bring, that's what's scarce. And that's what commands the premium. work under whatever banner you want, whichever vendor suits you and is the best match for you, right? Um, Here's another piece of information from this week. The UK government's AI talent strategy is actually creating a competition for the same clinical informaticians that the NHS needs. Tech companies are pulling people away, which means the NHS is going to have to compete harder with better salaries, better roles, better flexibility to keep the clinical talent in the system, in the room. NHS isn't great at that. So we'll see how they do. But they're all trying to get leverage to get you, to get your attention. Um, so let's think about that. Um, this is a huge change that I'm talking about. This digital health sort of life, and I don't think that I would have really believed all of it near the beginning of my career. So I kind of want to just get this grounded in a little bit of reality here. I used to set my alarm for either 4:30 or 5 a.m., depending on how far I needed to drive the next morning. I'd get a call about which hospital I'm going to go to because I was working a lot of per diem, which is like bank for the people in the UK. And they tell me where to go. I'd get ready, go to wherever I needed to go, and try to get there in enough time that we could get all of the paperwork done before I actually walk out of the door. Um, and I'd come home after that just completely depleted. Dinner, who cares? Wonder what time it was, like when I can get to sleep. Now I wake up and I choose the problems I'm going to solve that day. I choose the health system I'm helping. I choose the hours. And the work, the actual work, it matters more than ever because the scale is big, right? It's bigger than it's ever been. This is the shift. It's a shift work switch to freedom, right? And it's not just a financial freedom, because I've talked a lot about the money difference and how much money you make. It's also an intellectual freedom, the freedom the freedom to say, I want to work on this particular project in this country with this team. So, for instance, I worked with the Dubai hospital, the 9,000 mile round trip commute. That role existed because someone needed a clinical people who understood digital transformation and trusted them to do it without being in the building every day. And that was me, and that's the new normal. So what does your family see when they look at you right now? Are they seeing somebody who comes home after work all fulfilled and happy and joyous, or is it somebody who comes home empty, hollowed out, tired, dead? The transition of digital health, it changes that, and it changes it for the good. This hits me a little close to home because we're about to adopt, and I want to make sure that the child sees in me the person, perhaps a reflection of the person they want to be when they grow up. This is the shift work to freedom arc. It's real. It's happening for people I coach now, and it starts with believing the stage that you play on can be bigger. I wanted to share a story with you today. I'll use my client's first name, but not her last name. Her first name is Tina. We started working together. She had experience that she didn't know she had. I reframed some of her experience. I gave her some outright training. As of today, she has a start date for her new digital health job. She'll be working. She started off in the States, and she'll be working in Ireland. And she'll be doing that work starting not next week, but the Monday after that. And it's a huge, dramatic difference. She was not clinical. She is not clinical. She was not technical. She is not technical. She's never written any code or that sort of thing. She's purely clinical. She's an experienced nurse. She knows what she's doing. She feels clinically competent and not like she knows everything in the world, but she knows what she does. She knows it really well. And she believed that she could change this. She changed not just her job and what she does, but where she does it, the entire country that she does it in. So I was just messaging with her earlier today, and she's out there, and she's not unique. She's just my most recent client who's making the trip or making the transition, and I'll be working with her to make sure that transition is nice and pretty, so that she gets set up for success right from the beginning. So So if you think, I don't have a technical background, well, neither did my other clients. There were nurses who became the champions, and poof, the tech is learnable. It's actually easier than the clinical stuff. The clinical judgment, that's what takes a long time to learn. You can't teach tech people clinical. You can teach clinical people technical. Very easy. If you think you're too old, that it's too late to start, doesn't matter. The NHS Fellowship is in clinical AI is recruiting right now. They're desperate. BCG is saying this is the year of full-scale integration. If anything, seniority is an accelerant right now, not a barrier. People want to be comfortable that you know what you're doing. And the rooms you need to be in are the ones where your clinical credibility opens that door. If you're worried about job security in digital health, um, the Intel story is worth telling briefly here. Freelancers and employees carry the same risk of redundancy, but only one of them gets honest compensation for it. I was at Intel when they laid off like 20,000 people, and they laid off people who'd been working there for 20 years, and they didn't think anything of it. Well, I learned then that it's important to get paid what you're worth, because the chances of losing your job to a layoff versus a contract ending are exactly the same. But in the interim with the contract, you get paid more. So meaningful work in 2026 is about scale. The NHS needs 12,000 of us working in clinical informatics. AI is moving from pilot to embedded in the real life healthcare right now. And 2027 to 2029 is the window. This is the moment. And clinical people with your background are exactly who this transformation needs. So if you want a roadmap, the actual steps from clinical to digital health career, DM me the word roadmap, and I'll send you a digital health career transition guide, no cost, no clarity. Or head over to rodgamble.com. You should probably see that at the bottom of the website, and everything is there: the coaching, the resources, the community. Preview, and I'll see everyone next week. I come on every week at 6 o'clock on UK time. And now the UK and the US are back in sync. The times of day have come back together with the daylight savings lining up, because they change, but they don't change at the same time. All right. Good night, everyone. I'll see you next week, and DM me if you've got something specific for